Three. Hi, my name is Terry Bilbrough, and I'm a registered nurse. This is my final examination, physical examination for Nursing 360, and my participant today is Jacob. I've just washed my hands, and we are going to go ahead and start assessing his vital signs. We have blood pressure of 116/74, heart rate 72, respirations 18. Jacob is 6'1", weighs 195 pounds. His BMI is 26. While I'm assessing Jacob, I'm also going to be looking at his general overall appearance, behavior, cognition, and emotional well-being, emotional health as well. So we're going to start the examination from head to toe, and we'll start with his head. So as I'm looking at Jacob's head, I'm looking for any bumps, any lesions, anything abnormal in the scalp, as well as any hair loss. And as I'm feeling his scalp, I don't feel anything. His scalp looks normocephalic. I'm going to go ahead and press on Jacob's posterior cervical, trapezius, and again mandibular, mastoid area, just to see if, just checking muscle tone and rigidity, normal. Now I'm going to look at Jacob's face. As I look at Jacob's face, I'm looking for symmetry and any abnormal signs. I'm going to have Jacob open his mouth, okay, and then Jacob push down on my hand. Great. Can you puff out your cheeks for me? Make a frown. Okay, smile. And then go ahead and push, take your tongue, push it against your cheek, push against my hand, great. Another side, wonderful. Okay, I'm looking for cranial nerves number 5 and 7 here. Now, I'm going to go ahead and do a little sensory test. Jacob, I'm going to touch your forehead, and actually I'm going to touch your face, and I'd like you to tell me when my finger touches your face. Please let me know by saying yes.
Yes, 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 yes.
Okay. Cranial nerve number 5, trigeminal sensory. Okay, now I'm looking at Jacob's eyebrows, lashes, everything looks intact here. I don't see any lesions or any funny abnormalities. And then Jacob, could you look straight ahead for me? Okay, I'm going to be looking at Jacob's pupils. Iris is normal, lenses are clear. And as I look at Jacob's pupils, I'm going to look for reaction to light and accommodation. So, okay, reactive, great. Jacob, I'm going to have you, I'm going to cover one of your eyes. Okay, and I just want you to look straight at me. Good, okay. Great, EOMS is great. I'm going to go ahead and have you now put this paper over one eye. You're going to hold this with your other hand, and I'd like you to read this last line here, okay?
4, 2, 6, 7, 3, 9.
Okay, we're going to change sides, and then I'd like you to read that backwards.
Okay. 9, 3, 7, 6, 2, 4.
Great, that's perfect. All right, now we're going to check the movement of Jacob's eyes. So I'm going to stand in front of you here, Jacob, and I want you to keep your head towards me, and I just want you to follow my finger, okay? Great, okay. So checking cranial nerves number 3, 4, and 6. Okay, now we're going to go from Jacob's, and actually I'm going to check a little red light reflex here at an angle. I'm looking at Jacob's eyes here. Okay, good. Now from here we're going to go to Jacob's ears, and what I'm looking for is symmetry. I'm going from the lateral canthus of Jacob's eyelid to his ear. I'm going to be pulling on the pinna. Is there any pain or discomfort as I pull? Okay. I'm also going to be feeling around the ear to see if there's any lumps, bruises, lumps, or any lesions. Looking around, assessing. I don't see anything here. Okay. Jacob, I'm going to whisper in your ear, and what I'd like you to do is I'd like you to put your right hand over your right ear, and then as I whisper these words to you, I want you to repeat them back to me.
Okay. Monday, orange, football.
Great. Okay. I'm going to go to the other side. Same thing. I'm going to go ahead and tug on the pinna. Any pain, discomfort?
None at all.
Okay. Pressing. And I don't feel any lumps. Again, assessing any lesions, adhesions. Okay. And Jacob, I'm going to do that. We're going to do that test on this side again. And I would like you to put your left hand on your ear, and I'm going to again 3 words. Tuesday, soccer, yellow.
Tuesday, soccer, yellow.
Great. Perfect. Okay. From the ears, I'm going to Jacob's nose. I'm going to go ahead and palpate his nose and feel for any, again, abnormalities. Okay. And then Jacob, I'm going to press on your left nostril, and I want you to blow out your right. Okay, good. And go to the other side. Okay. Do you feel any obstructions? Okay. And I don't hear anything obstructive. From the nose, I'm going to Jacob's mouth. And as I look at Jacob's mouth, I'm going to start with his lips and then go into the oral cavity. So I don't see anything abnormal. Jacob's lips are full, no sores, redness, adhesions. Okay. So Jacob, I'm going to go ahead and open your mouth for me. I'm looking at Jacob's dentation here. He's got some cavities and a crown, it looks like. Hard palate, normal. No redness, sores or lesions. Tongue is normal. Okay, can you go ahead, Jacob, and stick your tongue out and go, Okay. Good. Uvula is midline and again races. We're looking at cranial nerve number 10. Okay, now, from here, I'm going to go ahead and we're going to check some lymphadenopathy. So I'm going to see if there's any lymph nodes that we can feel or assess. I'm going to start with the sternals. Okay, nothing here. Submental. Okay. And then I'm looking at Jacob's neck, and I'm looking at his trachea, midline and intact. Okay. I'm also going to feel posterior. And then again, anterior. And then I'm going to go up to the intrascapular area. And then infra. And I don't feel anything abnormal, any bumps, lymph nodes. Now, I'm going to go ahead and we're going to assess Jacob's thorax. So the first thing I'm going to look at is just view Jacob's thorax, and I don't see anything abnormal in presentation. Checking the anterior posterior and the shoulders, and it looks like it's about 1 to 2. There's nothing significant here. I'm going to go ahead and assess his lung sounds. And Jacob, what I'm going to have you do is I'm going to have you take a deep breath, and then as you exhale, I want you to exhale out of your mouth, okay? So, when you're ready. Okay, exhale out of your mouth. Good. Very good. Okay, I don't hear anything. Lungs are clear to auscultation. Jacob, I'm going to have you take a deep breath, and then I want you to exhale. Good. Normal chest expansion. Excuse me. Now I'm going to just do a little a percussion on your back, so you're going to feel a little bit of pounding on your back. Just checking for CVA. Okay. Any tenderness, pain, discomfort? Okay, good. All right, great. All right, from here I'm going to check anteriorly. We're going to listen to Jacob's lungs. So once again, Jacob, take a deep breath for me. Okay, again, once again, clear to auscultation. All right, from here, I'm going to have Jacob go ahead and lie down. Now, I'm going to also be pressing and just checking for valvular shunting. So I'm checking the aortic region, pulmonic region, tricuspid region, mitral, and also I'm checking for PMI. Jacob, I'm going to go ahead and press, and then I want you to take a nice deep breath for me. Okay, and again, no abnormalities. I'm going to go ahead and listen now for shunting. I'm going to start with the aortic region, which is the second intercostal right sternal base. I'm starting with the diaphragm to hear for high-pitched sounds. Going to pulmonic. And again, second intercostal left sternal base, Erb's point. Third intercostal left sternal base, tricuspid. Fifth intercostal midclavicular. And then mitral. Fifth intercostal lateral. I'm going to turn the bell over. Listen for deeper tones. Mitral. Tricuspid. And again, back to Erb's point, third intercostal, left sternal base, pulmonic, and once again, aortic. The last thing I'm going to do before we stop the film is I'm going to check for the carotids, checking for bruits. Negative, and I'm also checking aorta. And then last part is renals. Again, checking for bruits. And we're going to stop the tape at this point to take a break and then finish up the assessment.